Today's medication is going to be diphenhydramine, commonly known as the brand name of Benadryl. The classification is going to be an antihistamine. There are histamines in our body that cause inflammation and swelling. The mechanism of action for this medication is it's going to be an H1 receptor antagonist, or it's going to block the H1 receptors that can be found in the airways, GI tract, blood vessels, and other various tissues. By blocking these receptors from binding, it's going to lessen the allergic reaction or anaphylactic response to the allergy cascade. The pharmacokinetics, it's going to begin within 1 to 5 minutes of your IV dose, so it is very quick. Peak effect will be around 1 to 4 hours, and it's metabolized in the liver. Your indications for giving Benadryl is allergic reaction, anaphylaxis, as those are systemic and life-threatening reactions, dystonic reactions, which are spasmodic contractions of muscles in the face, neck, and extremities. It can be also used for chemical restraint. Contraindications are anybody that is a known allergy to diphenhydramine or acute asthma exacerbation. The reason why we say that is we're not giving it just for the asthmatic patient, as it can dry the secretions in the upper and lower respiratory tracts, which can help relieve symptoms for some people, but it may make the irritation worse for others. Adverse effects are going to be drowsiness, loss of coordination, blurred vision, headache, hypotension, tachycardia, palpitations, or thickening of the bronchial secretions leading to chest tightness and wheezing. Precautions: we want to be cautious in giving this medication for patients with severe vomiting, alcohol intoxication, and we want to make sure that we're being cautious when giving this to nursing mothers. Also, any patient with a decreased level of consciousness. Your adult dose is going to be 25 to 50 milligrams, slow, IV, IO, or IM. And your pediatric dose is going to be 1 milligram per kilogram, slow, IV, IO, or IM, with a max dose of 25 milligrams. Here I have a vial of the medication, and you will see, we know that our dose is 25 to 50 milligrams. I have 50 milligrams per ml, so you should then either be giving half of an ml or 1 ml to meet your full max 50 milligram dose. When giving this with epi, we don't want to delay epi, as that is going to be our first line medication for anaphylaxis, but we do want to make sure that we are getting our Benadryl quickly on board. Keep in mind that Benadryl can also be potentiated by other central nervous system depressants, so when you give this with other medications such as a narcotic, a benzodiazepine, the overall effect can be potentiated. Benadryl is also a potent anticholinergic agent and can lead to reflective tachycardia, dry mouth, and pupil dilation. High doses can cause delirium and hallucinations. Another thing to think about is one of the leading ingredients in ZzzQuil is diphenhydramine.